Great. Thank you very much, Danvik. We're now going to move on to the panel discussion, which you're going to chair. And we're going to be joined by Heather and Will, but also three other panelists. We're going to have Nini from Myanmar, Jan Lee from the Philippines, and Rena, who joined us last year. And I've been quoting you, Rena, ever since, and every time I talk about stigma, from Thailand. So I'm going to hand over to you, Danvik. But I thought, as the co-chair, I'd ask the first question, if that's okay. It just strikes me that we talk about risk all the time and risky behavior, and that itself, the way we talk about PrEP is rather stigmatizing. And rather than talking about risk and risky behavior, should we just be addressing why individuals want to take PrEP and forget about the idea of risk?
Well, I think that would be an ideal situation to be in. Well, if everyone wants to take PrEP, regardless of their risk, let's have them take PrEP. While it is ideal, of course, there are some circumstances that it's actually out of our hand. There are some instances where resource may be limited for providers, or there are concerns from different clients. I think it's really important for us to strike a balance between this. Providers should also think that, of course, all of our services should be client-centered, thinking that we should be putting clients' perspective, because they will be the ones who will be accessing the service. Understanding their concerns is important so that, we will be able to address their concerns, answer any questions that may have. And that's why we are having this forum today. It's an opportunity for us to understand their concerns and discuss how can we address all of these situations. In ideal world, of course, we can have them access PrEP, but it's not ideal as of now. Yeah, so I think, well, aside from, of course, we would want to entertain other questions from our audience, but as we encourage the audience, of course, to type in your questions if you have. But I think I should start first the conversation from some of the presentations that were presented earlier. Maybe I can ask the first question to Heather Marie. We know that we already have evidence that stigma excludes people who we know that we can benefit from PrEP. From your perspective, how can we help policymakers to understand that stigma needs to be addressed in order to provide that enabling environment for people to access PrEP? Because awareness for stigma is already a thing, but making them understand is a different thing. What are your perspectives for that?
Thanks, Danvik. It's a good question, and it is a little bit complicated, but I think some of the things that we need to really look at is whether really there is I think the data for policymakers is really important to look at where stigma really does in practice become a barrier to accessing services and to taking them up, and also to continuing with services. Data is incredibly powerful for policymakers. One of the other things that's really important is also looking at where in those that flow the barriers really end up being, because I think it's not that policymakers don't necessarily intellectually understand that stigma is a barrier, but sometimes it's understanding where that problem is, and also understanding what to do about it. Because I think we've been talking for a lot of years about ending stigma and discrimination, and I think we're a little bit closer, but I think we've still got a really long way to go. And I think it's been one of those really wicked problems that requires a whole of society change and a whole of society approach. And we cannot address it simply by talking within communities, within small groups of people, within people who are already in the tent. We need to make much bigger changes societally. And some of that is about awareness raising and about just really normalizing a lot of these conversations and getting over some of the stigma associated with sex, for example. So I think, we need to look at the data, but we also need to be able to give policymakers a solution. And so that would be, I think, where we need to start.
I agree that it is. Our approach should be a multi-sectoral one, because, even health policymakers cannot solve the problem alone. Especially, there are many disempowered and marginalized users who cannot access PrEP, and these are caused by multi-sectoral problems. And with relation to that, I would want to ask Will that we know that it is very evident that stigma has already affected and created barriers to PrEP access, to what I said earlier, to disempowered and marginalized users. Can you provide some examples on how we can overcome these barriers?
Sure. First of all, I really want to say I totally agree with Heather Marie's analysis that, tackling stigma and discrimination is not going to be solved by putting adverts on the back of buses or by having nice glossy video presentations about what stigma is. We have to tackle stigma and discrimination at every single level, and we're not going to solve it overnight in the same ways as we know or it's taking decades and decades to tackle HIV stigma, of which PrEP stigma is a subset. But what kind of tangible things can we start to do? Well, in my presentation, I gave some examples, and I want to respond, I guess, in part looking at some of the questions that are coming in. One of the things that we can do is to make sure that those of us who are PrEP users are supported, are resourced to be confident, empowered to talk about our own PrEP use, to talk about the difference that this makes on our own lives, on our own health, and our own well-being. And I work in an organization that is made up predominantly of those of us who seek to use PrEP or have used PrEP or are using PrEP. And we see ourselves as probably the most powerful tool that we have to tackle stigma and discrimination. And I know I come from a very privileged position. I know I have infrastructure and resources and support to enable me to be very out about my PrEP use. And PrEPster and many other grassroots organizations around the world are spending significant amount of time and energy supporting PrEP users to stand up and talk about what using PrEP means for us, for the sex we have, for our sexual partners, in taking control of our HIV prevention alongside those of us who are having sex or have partners who are living with HIV. It's a very, very empowering narrative and empowering story. So I think we are the tool alongside policymakers and clinicians, people living with HIV. PrEP users are the most powerful tool that we have to tackle stigma and discrimination.
I love how you said, Will, that PrEP users are the most powerful tool for us to discuss and hopefully eliminate stigma and discrimination. And I think let's focus on the users now. And I have this question for Nini. Speaking of users, there are some concerns from potential PrEP users saying that they don't want to take PrEP because they think that the people in their circle, whether their family or their friends, may think that they are at high risk because they are stigmatized, that they have multiple partners if they take PrEP. How do you think we should address this?
Thank you. This is very important and striking question. And then this is also the very important question that we are facing day by day in our PrEP program. And well, it's not only in Myanmar, but also I believe in many other countries, there are a number of evidences that PrEP, because of our traditional way of making eligibility of PrEP, which is people are used to us, you have a high risk behavior, which is completely wrong. We have to change that. As long as we are using that, that means we are stigmatizing our population. So what we should do? We should promote sexual health, and we should say that this is someone who take care of sexual health and who want to reduce their anxiety about HIV, who concerned about HIV. So PrEP is here. This is for somebody who want to have normal sexual health and who are worried about HIV. I think we should definitely change our approach in every perspective, in provider side, in the user side, and also in the public sector side. So I think if we change that perception and we advocate in the way of sexual health, it will normalize the PrEP use and destigmatize. So something example of the use of female contraception in the earlier time. And also that people were worried, okay, if we advocate this, will we increase promiscuity, which would completely not true, right? So this is something we need to advocate for destigmatization. Yeah, thank you.
I agree with your insights, Nini, and I love how you said it from a provider's perspective. And speaking of provider's perspective, we know that RINA is leading one of the providers that really specifically caters to transgender population. From your experience as a provider, what kind of stigma has mostly affected access to PrEP among transgender population?
Yes, thank you very much, Danvik, for the question. And I would like to thank the organizer for inviting me to this forum. I think it's a pleasure to be here again. So I think to respond to your question, I think I would like to underscore what Dr. Nini already addressed. I think in my life, in my entire 6 years working at the Tangerine Clinic, I haven't seen any transgender women or trans people coming for their first visit at the Tangerine Clinic and tell me that they wanted PrEP. PrEP is right for them today. And at the beginning of last year, we have met as a team to review our PrEP strategies and the lesson learned, what's happened about the low PrEP uptake among the transgender individuals at the Tangerine Clinic. And we found that one of the main barriers or factors contributed to the low PrEP uptake among the transgender sisters and brothers at our clinic was unintentional stigma and discrimination from healthcare providers. Can you imagine? Once a transgender individual coming to the clinic and they tell you that what kind of services they wanted today, and then you started by using the risk assessment tool or screening with them. Once they complete the questionnaire and then they would be eligible to get PrEP, you will complete the conclusion and discussion and what conversation with them that, oh, PrEP is right for you because you have multiple sex partner, you engage in sex work, you having STI history, and you're using substance. So if you don't get PrEP today, you might get HIV in the next few days. So I think it's our good intention, but most of the time as a providers, we always forgetting that our journey is different from their journey. And PrEP is not everything in their life. And I also understand that for a transgender woman who they're taking PrEP, it requires a lot of inner strength to overcome or to coping the stigma associated with PrEP and other vulnerabilities that they are facing. For example, they might be sex worker, they might be experience school bullying or drop out and experience domestic violence. So it's multi-level of stigma and discrimination that they're experiencing rather than PrEP stigma. So I think at the clinic right now, we review the strategies, we talk as a team what was going on, and we were not doing the right thing to serve our trans population. So we revised our strategies, we developed the gain framing approach counseling, and then what was already shared by Dr. Nitya and by Dr. Heather Marie at the previous presentation. And I would like to emphasize that when you're offering PrEP should be offered as part of the comprehensive health service package for transgender people. In Thailand, PrEP is freely available, but it's not accessible. Not every transgender woman wanted to take their courage to go to the sexual health clinic and tell the provider that I wanted PrEP today. PrEP is right for me. No, there are other unmet health needs and other competing health priorities that they are looking for For example, they might want mental health support, they might want gender affirming hormone treatment and surgery, and those PrEP facility cannot provide this transgender specific health service for them. And I wanted to end here and then maybe discuss later on. Thank you.
Thank you so much, Rina, for passionately sharing to us where stigma is coming from. And I understand, of course, especially with transgender population, it might be, their concern in accessing a health service might not be PrEP in itself, but there are other concerns, and this should be addressed. I agree with that. But let's focus on the user. Like, I would like to collect insights from Jan Lee, coming from what Rina shared, from your perspective as a PrEP user and transgender woman. Where do you think stigma surrounding PrEP usage or stigma in general is coming from, and how do you think we can address it?
Yeah, so I definitely agree with everything that Rina said. Agree that the stigma associated with PrEP usage comes from multiple layers of discrimination and stigma. And if we dig deeper, we will understand that stigma associated with PrEP is actually connected to stigma associated with HIV and AIDS. And here in the Philippines, it's very prevalent. So, and if we go a little deeper, the stigma associated with HIV and AIDS is actually associated to stigma about being sexually active and being sex positive, right? So the Philippines, particularly, I can speak on behalf of my fellow Filipinos, that we're known to be quite conservative, given that we are a largely Catholic country. So there is so much stigma surrounding people being sexually active, being open about their sexual activities. It's not very commonly talked about here in the Philippines. We don't even have sex education. Is not even a huge or an important part of the curriculum in schools, right? So when I think about that, it makes me question where is this stigma about sexual activity and sex positivity is coming from. And upon reflection, I think it's all rooted from being colonized by the Philippines being a colony for hundreds of years. So up until now, this colonial mentality is still very much present. We have internalized this colonial, we have internalized colonialism, which then prevents us from being fully responsible or having full responsibility over our bodies. Therefore, we do not, we allow other people to take control of how we make use of our bodies, and it definitely influences us about what others might think if we tell them we're sexually active and we are sex positive. So this colonial mentality, this internalized colonialism is very dangerous, and it's still very prevalent among Filipinos now because there is shame and stigma associated to being sex positive. Therefore, we let other people colonize our bodies, and that's when we engage in risky sexual behaviors. Since we have no full hold of being responsible with our bodies, we let others take control over us. So this is when Filipinos tend to allow others to engage in sexual activity without protection because they want to please that other person. So that's where sexual irresponsibility is coming from. So as a country colonized by hundreds of years, it's important to look back to our roots, and that's our pickup point on how we can address this stigma and discrimination associated with PrEP. So again, as Rina said, it's really multiple layers of stigma and discrimination, and also history. So how do we address this? We need to tell people to be responsible, to have full responsibility over their bodies. And the way to do this is, of course, number one, to unlearn misconceptions about sexual positivity Because here in the Philippines, when you talk about sexual positivity, people often think that people equate it with promiscuity, when in fact those are different things. So sexual positivity is it's something that we can educate people about, so that they can unlearn misconceptions, and at the same time, we can after promoting sexual positivity, of course, we have to focus on the person, and that's when we should help people develop their self-worth. Because when you have low self-worth, that's when you allow others to take control of your bodies. But then when you develop self-worth, then that's when you can be confident enough to say no to risky sexual behaviors, to protect yourself from risky encounters, to do combination prevention methods, including the usage of PrEP. So, and Love Yourself, as a volunteer of Love Yourself for almost 6 years now, this is something that we have done in all of our campaigns, awareness campaigns, to promote self-worth, because really that's where it all starts.
I love how you put it, Janly, especially when it's not only limited in the Philippines, but in many conservative cultures worldwide, that if we view sex as taboo, that's the time that we cannot discuss, issues that are connected to sex, including, of course, HIV, teenage pregnancy, and sexually transmitted infections, and everything that's connected to sex, especially if we view it if you don't view it in a manner where we discuss sex as non-taboo. I think it's really cultural, but I think it's time we can discuss it and more. But I think it's now the time for the audience to jump into our conversation. I think I'll be looking at the questions from the audience, and I think the first question from the audience, Will can answer this. There's a question from Ana Marie Duncal Llorilla. What can you say about providers advising against using PrEP due to the reason that the partner is already undetectable?
I'm sorry, can you say that question again, please?
Okay, the question is, what can you say about providers advising against using PrEP due to the reason that the partner is already undetectable?
Yeah, so I think this is a very common scenario that we're talking to providers about in the work that we're doing here in the UK, and I know other collaborators across the world are seeing this issue as well. So providers suggesting that someone does not need to have PrEP because their partner is diagnosed with HIV and has an undetectable viral load. I think that's what the question was. And I think there are a number of things for us to unpick here. The first is the assumption by the provider that potential PrEP user is monogamous and only has one partner. We know lots of us who are using PrEP are not monogamous. I'm certainly not. But also, for me, there's an issue here about a potential PrEP user being in control, having their own agency. I loved what Janny just said about taking responsibility for your own health. Now, I've just been having a conversation with a sexual partner in the last week about whether he should start taking PrEP. And he was saying, well, I don't need to because everyone else I'm having sex with is also a PrEP user. But what happens when that PrEP user forgets to take their PrEP? What happens if the HIV positive partner takes a drug holiday and their viral load increases, or something else is going on? And I think for me, the fantastic thing about PrEP is it allows us our sexual autonomy. It allows us our prevention autonomy. I do not need to rely and put an added burden on my HIV positive lovers to remember to take their meds or to be in control of my health as well as their own health. And I want to add a slightly different perspective here about some of the conversations that we've been having around perceptions of risk to facilitate access to PrEP use. And one of the terminologies we've started using within PrEPster is, rather than talking about risk behaviours, talking about PrEP beneficiaries, people who could benefit from PrEP. And I think I'd like us to start thinking about reframing our language about potential PrEP users, moving away from us being risk takers and talking about the other benefits of taking PrEP or potentially taking PrEP. And for me, that means increasing my sexual pleasure, increasing my sexual control and my sexual autonomy, reducing anxiety, reducing stress, being in control. These are all kind of languages and terminology we can start using instead of talking just about these risk narratives that may actually build on some of the stigma and discrimination, particularly around HIV stigma and discrimination.
Nicely put, Will. Thank you. I think for the next question, I'd like to ask this to Heather Marie. This is a question from Suleiman Tasembido. Sometimes identity and risk-taking or perceived risk are interlinked. How to proceed without distinguishing individuals regarding their risk-taking behavior, above all in resource-limited settings?
I think this is an excellent question and an excellent point, and it does come up quite often. It's true that identity and risk-taking, and particularly, and I think importantly, perceived risk-taking, is very much interlinked from a policy point of view, from a provider point of view, and also from a community point of view. And this is, for example, reflected in guidelines that don't nuance risk away from identity. They identify key populations as monoliths with a uniform risk, which is not really helpful for PrEP. It's not helpful for people because we know that there are members of key populations who would benefit from PrEP. We know that there are people who are not members of key populations who would benefit from PrEP. So really what we want to see is that this starts to be moved away from a risk analysis and towards really a conversation about how somebody might benefit from PrEP. And again, it's because, as Will said, I love the word beneficiaries. I've been talking about benefiting from PrEP for a long time, but I'm now going to start using PrEP beneficiaries. And because we know that people who ask for PrEP, overwhelmingly, they need it. And so having that conversation to see if somebody would benefit from PrEP, and whether it's an approach they would benefit from, I think is where we need to shift the way that we are talking about PrEP, all the way from policy through to service provision.
Another related question, actually, for I think Heather Marie would be the best person to answer this. It's a question from William Huang, and he asks, is there analysis that non-judgmental PrEP providing with sexual health and risk of sexually transmitted diseases? Since some doctors concerned that PrEP can be misinterpreted as okay for non-protected sex, especially for some certain people.
Again, this is a conversation that does come up quite a lot, but I think we need to start to, again, reframe this conversation. Because, when we talk about condomless sex, condomless sex does not necessarily equal unprotected sex. By somebody using PrEP, they are having protected sex. There are many ways that you can protect yourself from HIV during sex, and PrEP and condoms are two options, and you could use both of them if you want to. But we need to make sure that this is what we're talking about. And so, I already mentioned that people who are using PrEP, they tend to they tend to know that that they would benefit from PrEP, and we need to look at the way that PrEP is intended to be used. PrEP is intended to prevent HIV. That is how we should be looking at it, and the paradigm that we need to be looking at it in terms of. And we need to look at who's using it. People who are using PrEP overwhelmingly are not using condoms consistently, or they don't want to use condoms consistently. If somebody's happy using condoms, then they don't need to use PrEP. And so I think we're really conflating a lot of issues here with a general uncomfortableness with what not using condoms means. And it doesn't mean that somebody is unprotected. It doesn't mean that somebody is irresponsible. It means that they've chosen another very effective way to prevent HIV. And so what's really key here is the engagement with care while people are taking PrEP, and even once they've finished, engagement with sexual health care and regular STI testing. Because these people who are engaging with care, anybody who's taking PrEP and having regular STI testing, they're improving their sexual health much more probably than somebody who uses condoms but never has an STI test. So I think reframe that conversation.
I love the advice of reframing the conversation, because I think it's important for us to look at things on a different perspective, especially, if we really want to be client-centered to all of our services. The next question would be for Nini, and this is a question from Than Naing U. Apologies if I am mispronouncing your names. The question is, I saw a PrEP campaign in Bangkok adopted to Myanmar language. Did you have any Pacific campaign strategy for Myanmar, specifically for migrant people?
Thank you. I actually do not aware of the Bangkok campaign for Myanmar, but for in our country, I will explain a little bit what we are doing about the migrant population right now for the PrEP and demand. So right now, as you might notice, we have quite a lot of problems, especially the program area where we are working for PrEP service provision in Yangon. We have a lot of immigration and our migration. People move in and out. A lot of people kind of lost a job and moved out of the area. So we are now doing qualitative study and trying to find out what will be the best way for the client perspective of care. So what do they need? So we cannot go to the traditional way of the PrEP dispensing. Right now we have the 3 PrEP sites in Yangon. Right after a qualitative study, we expected that the conflict situation, how are we going to adapt our PrEP service provision in terms of flexibility? How are we going to increase the PrEP provision to our PrEP clients? So we are still under process how to improve our PrEP demand, because there are a number of PrEP discontinuation during this conflict time. So we do concern about that. So this is what we are doing right now, but I am not aware of the PrEP in Bangkok and for Myanmar campaign. Yeah. Thank you.
Thank you so much for that, Nini. I think the next question from the audience, I think Rina can share some insights on this. There's a question from Natasha Julien Delgado. Providers are not confident to prescribe PrEP because most are primary care providers who are limited by the healthcare system. Lack of institutional or national support, lack of capacity of providers or capacity building or credentialing them might help. And we should empower the providers first. What are your insights on this? And I think Heather Mary can also jump into this question.
Yes, thank you, Danvik. I think this question is actually for Dr. Nitya, because I'm not a doctor, but I would say that in Thailand's context, we really promoting the key population lay providers. They have to be trained, they have to be certified, and that's why they are able to dispense PrEP with the medical supervision from the physician working remotely at the hospital or at the clinic. So if you are a general practitioner or you are not the ID doctor, I'm sure that you can still, I think it is ethical for you to provide PrEP to your vulnerable population in your setting. And I would like to move to the next question from Raju Lama about if some trans are coming for PrEP, but she did not want to share about their sexual history, would she be eligible for PrEP? I think first thing you have to do is to revisit your counseling quality and ask about your facility that whether or not your service is friendly enough for transgender people to share everything with you. At the Tangerine Clinic last week, we have a few transgender PrEP women who are coming for PrEP, and they said they were not at risk, but they were interested in getting PrEP. And the Tangerine Clinic we respect their informed decision by prescribing PrEP to them. After we clearing the HIV testing, we ensure that they know how to take PrEP. PrEP can be taken daily with their gender-affirming hormones. So why not? If they really wanted to take it, they know how to protect their health. Thank you.
Thank you so much, Rina. And I think my next question is for Jan Lee. As a marketing expert, what do you think what role does marketing and PR play in eliminating PrEP-related stigma? And how do you think the members of the media and key opinion leaders responsibly can support PrEP usage?
So this is actually something that I've been doing for a while now, having been a volunteer of Love Yourself. You know, we've done local campaigns, Danvik, about promoting HIV and AIDS awareness. And of course, the same would apply for PrEP. I think it has to come from a very casual and relatable approach, because I would like to recall what Rina mentioned when you know, people feel that, when consumers feel that they are being judged with their actions for being sexually active or being sex positive, there's already a barrier that we're forming. So we don't want people to use PrEP out of fear, but you know, again, the main idea is to promote being, as I mentioned, being responsible, having agency over our bodies and our sexual health. So to be able to do this, it's the first thing that we need to do is to, of course, conduct trainings, educational trainings for the members of the media about HIV and AIDS and PrEP and combination prevention methods. And of course, we can invite key opinion leaders such as content creators in social media, your YouTubers, bloggers, and of course your celebrities and influencers. So especially here in the Philippines, we are very huge on being influenced by social media and by celebrities. So when celebrities and influencers talk, people listen. So we have to connect to people and communicate to people through them, through the media and through the key opinion leaders, by number one, doing the educational trainings, and then number two, doing campaigns that are friendly in approach, which will strengthen the desire of people to be fully responsible and have agency over their bodies and sexual health. So we can utilize different forms of media such as TV, especially here in the Philippines, we're still very huge on TV consumption. Digital, of course, your websites. There's print also, your dailies and glossies, and digital and social media, of course, your content creators, influencers, and your celebrities. So this is something we've been doing for In Love Yourself, and something we can amplify for PrEP also.
I love how you put that, Janly, you know, exploring traditional and non-traditional ways on how to promote a HIV-related service, especially PrEP. The next question from an audience, I think anyone can jump in and have some insights related to this. There's a question from Scott McGill. Is sex phobia or slut shaming the same as HIV stigma? And can PrEP users, in fact, be a source of HIV stigma and discrimination? For example, some PrEP users, for example, on apps that are essentially advertising negative status and may reject people living with HIV, including those with undetectable viral load. What are your insights on this? Anyone can jump in. Maybe let's hear from either Will or Heather Marie. What can you say about these insights?
I have something that's slightly related to this, and was going to be probably my closing comment. So you've got my closing comment coming up now. So save some time. I think there are two possible inadvertent PrEP-related HIV stigma things that are playing out right now. The first is in my pre-PrEP generation, there was some HIV-related stigma relating to those of my peers who received an HIV diagnosis, a sense of, why did you allow this to happen to yourself? You should have known better. Why did you not use condoms? PrEP has added a second layer into that. For those people, those of my peers who now receive an HIV diagnosis, is either, why did you not use condoms? Or why on earth did you not make the best? PrEP was available. Why on earth did you not use it? And I think we're in real danger that as we add new prevention technologies into the mix, we will get more blaming and more shaming of those people who receive an HIV diagnosis. We cannot allow that to happen. We can absolutely not allow that to happen. The second thing that's happening is that I grew up in a generation when it was really common for my friends and my peers and my sexual network for someone to tell me that they had recently received an HIV positive diagnosis. And because of, in some parts of the world, the massive success of PrEP, the massive success of U=U, we are seeing a major fall in HIV incidence. And that means for guys and well, everyone in a younger generation, they are now not growing up finding out or learning about someone with HIV from their own peer group. That means that they're not getting to understand what it's like to receive a positive diagnosis, or they're inadvertently believing that there could be nobody in their own age group, their own peer group, living with HIV. And we know HIV stigma reduces when we know people with HIV around us who we love, who we have sex with, and who we care for. So again, there's possibly a perverse thing happening that PrEP and U=U together could be contributing to the further marginalization of people who already have HIV or who become diagnosed with HIV in the near future.
Thank you so much, Will. And I think as we draw to a close, as you said, we thank you for those closing words. I think let's hear some closing words from other people from the panel. I'll start first with Heather Marie.
Thanks. And I mean, I just want to respond a little bit to that question as well, because I think I completely agree with what Will said. And I think it's really important that while sex phobia is not the same as HIV stigma, they are incredibly related and they feed into each other. And so I think that the only way that we can really tackle HIV stigma is to tackle sexual stigma. But recognizing that PrEP users, yes, can be a source of HIV stigma. There is a lot of self-stigma associated with key populations, for example. And I think that there is no group that is immune from engaging with, suffering from, or perpetuating stigma, often unintentionally. And I think Scott's point about PrEP users, for example, advertising negative status is a really crucial one and speaks to something that I think Brent Allen spoke about in the chat as well, which is around there is really poor knowledge. There is poor knowledge about PrEP in our region. There is even worse knowledge about U=U. And I think we need to really look at how we are messaging HIV prevention more broadly and really bringing that conversation to the fact that there is a diversity of really empowering ways that people can take control of their sexual health and have a healthy sexual experience and, enjoy sex. So I would just like to kind of conclude with the fact that PrEP is effective. We know it's effective. It is incredibly complementary to other methods, and it is incredibly empowering. And it's really crucial that we make it available, that we hear from communities and individuals about how best to do that, because communities need to be involved at every step of the way, and that we create the supportive environments in terms of policy in the clinics and socially, so that we can finally start to put some of the stigma and discrimination to bed.
Thank you so much, Heather Marie. There's so many questions coming in, and we'll find time to for our panel to answer them in a separate manner. But I think let's hear some closing words from Nini.
Thank you. Will and Heather Mary. I completely agree with your response about this question. It's a very important question, actually. So I really completely support PrEP. It is very effective, but we have to destigmatize to break down all the barrier, and we need to make PrEP accessible. And then also, I really do believe the project that Rina is working on with the community-led PrEP, which is the next mission for Myanmar, I hope. And when, of course, we have to work very hard to go to that direction. Yeah, thanks for asking me to join the session.
Thank you so much for your insights, Nini. How about for your closing words, Rina?
Yes, my closing discussion will be the same as last year. And I would like to emphasize these messages. So to overcome PrEP stigma, we need to demedicalize PrEP. So I have 3 Ds. The first D is to destigmatize. Destigmatize was already suggested by Dr. Nini, and I would like to share a bit that lots of transgender people, they were worried about taking PrEP every day because they were afraid that their family members or partner will find out about if they take PrEP daily. So I think in terms of making PrEP options available rapidly, in terms of we learned that lots of long-acting injectable PrEP implant, or once a month PrEP would be available in the future. It can be helping destigmatizing PrEP. The second D is demystify. We learned that PrEP can be taken daily with gender-affirming hormones or any other supplements that transgender population always use. Make it publicly, disseminated widely at the national level. The policymakers should be responsible for disseminating these messages wider to the communities, demystify it. And the last one is decentralized. It's already widely discussed at this forum that task shifting and task sharing strategies is the way to go for our Asia and the Pacific countries. We should listen and empower to our community that we are serving to help end the AIDS epidemic in our region. Thank you very much.
Nicely put, Rina. Thank you so much for your closing words. And for your closing words, Janly.
So I think I would like to add another D to what Rina has already mentioned, and that's to develop self-worth and self-love, both for users and providers. For providers to be non-judgmental and to help their users develop their self-worth, not just by taking PrEP, but by engaging them in seminars and workshops that can help them really love themselves. And for users, to develop loving yourself, because it all starts there. If you love yourself enough, then you'll have full responsibility over your body and you let no one take control of you. And that is something very powerful. Thank you.
Thank you so much, Janly, and thank you to everyone who joined this very fruitful panel discussion. We appreciate all of your insights and inputs so that we could, continue to open conversations, because if we converse on things that, we hope that we would normalize discussions, not only about sex, but of course of, our own access to sexual health and wellness. Thank you so much for all of your insights. We will be having a 15-minute break after this panel, so that we will be, and I'll see you again on the second session. Thank you very much for listening.